My name's Trent Hummel. I'm a pediatric neuro-oncologist at Cincinnati Children's Hospital. I'm also a member of the board of directors of the Cure Starts Now Foundation.
And I'm Keith Desserich. I am chairman and co-founder of the Cure Starts Now.
So one of the other common questions that we get as second opinions is, should a biopsy be done? And I think in today's day and age, most physicians would say yes. And the reason is, if it can be done safely by an experienced neurosurgeon, then it should be done, because we are getting to the point where information in that biopsy may be critical to help you get on a clinical trial down the road, or to help you identify off-label treatments or genomic or genetic alterations to help you attack that tumor down the road. And previously we didn't have that information, and we didn't really have that technology to tie in biopsy to treatment, but more and more these days we're starting to do that, and more drugs are starting to become available. And more importantly is that some of these trials require certain intact genes. So if you don't have that intact gene, that drug A may not work. And so you would really want to know that before going into that trial, because if you don't have that intact gene, that drug will not work for you.
One of the other reasons why people are focusing on getting biopsies is also just for diagnosis, because we're finding out that in some of these, when you get a biopsy, we may find out it may not even be DIPG.
Correct, especially if your MRI looks atypical, and that's one of the questions to ask your physician at diagnosis is, does this look like a typical DIPG? If it looks atypical, that's even more reason to biopsy, because, as Keith said, it may not be a DIPG. It may be something else.